I'm Lisa Swanson. I'm a dermatologist and pediatric dermatologist here at Ada West Dermatology. I have been practicing dermatology for 11 years. I grew up in Scottsdale, Arizona. I was living in Denver, Colorado for the past 10 years before I moved to Boise, Idaho in summer of 2020. So I went to college at University of Colorado in Boulder. I went to medical school at Tulane in New Orleans. I did my residency in dermatology at the Mayo Clinic in Rochester, Minnesota, and I did a fellowship in pediatric dermatology at Phoenix Children's Hospital in Phoenix, Arizona. So I chose pediatric dermatology because I just realized I loved it. I was in my residency in dermatology, and I was the second year, and I was on my pediatric dermatology rotation. And prior to my residency in dermatology, I didn't even know pediatric dermatology existed. And so I'm on my rotation, and I just have this epiphany one day that I am happier when I'm doing pediatric dermatology. I just love it. I love the whole thing. I love the interactions with the patients. I love the interactions with the parents. I love that I can fix most of the stuff that I see. And I was really kind of surprised. I was like, do I really love this as much as I think I do? And sure enough, I did. So I went on to do a fellowship, and now I practice almost exclusively pediatric dermatology. I love Ada West. So I was happily living my life in Denver, Colorado up until a couple of years ago when Ada West reached out to me and said, hey, we don't have a pediatric dermatologist in the state of Idaho. How would you like to move to Idaho? And at first I was like, oh geez, do I want to move to Idaho? I've never lived in Idaho before. And so came up and visited and just fell in love, not only with the Boise, Idaho area, but with Ada West. The people here, the other doctors and providers here, the kindness of the people here, it just all blew me away. So I made the decision to make the move from Denver to Boise, and here I am, and I've been loving every minute of it. It's been great. Ooh, what did I want to be as a kid? Growing up, I think I always had a feeling that I would grow up and be a doctor. My dad's a doctor, my aunt's a doctor, my uncle's a doctor. And so I was definitely exposed to the field of medicine at an early age. And so I think it was always in the back of my mind that being a doctor was in my future. I did briefly have the aspiration of being a professional football player. I wanted to be a wide receiver in the NFL, but of course those dreams had to die when I maxed out at about 5'1" tall. So had to give up on the football career and therefore pursued a career in medicine and never looked back. It's been great.
That is one of the best answers I've ever heard. That's good for kids to hear.
Yeah.
Okay. How do you stay current with what is new and better?
Oh, so staying current is really important to me, and I love it. I tell people I am a journalaholic. I am reading the medical literature all the time, and I really look forward to it. I love learning new things, and I love learning new ways to help people with skin conditions that I see every single day. I love going to meetings. The whole COVID journey has been a struggle because we haven't been able to go to meetings, and I've really missed that. I've missed the knowledge that I gain in the lectures. I miss the camaraderie amongst other physicians and dermatologists. And so I really pride myself on working hard to stay current, not only because it's the right thing to do, but because I genuinely love it. Yes. So new advances in pediatric dermatology are amazing, and just there's something new every single day. We've had huge changes in how we manage two very common conditions in kids, atopic dermatitis, otherwise known as eczema, and also pediatric psoriasis. I tell kids that I diagnose with eczema and psoriasis, it's a good time to have these conditions because I have more tools ever in my toolbox, and we're getting more all the time. So we've had really major advances in treating these chronic skin diseases that really wreak havoc on a child's life and the whole family unit. So that's been very exciting. We have propranolol to treat hemangiomas in babies. I was actually born with 3 hemangiomas on my face when I was a baby. And so my mom says that I was destined to be a pediatric dermatologist because I dealt with hemangiomas early on. So I'm very passionate about hemangiomas, and we discovered by accident about 10 to 15 years ago that a medicine called propranolol works really well to treat them. And so I really enjoy having that be an aspect of my practice as well.
Can you explain what a hemangioma is?
Yes. So a hemangioma, for those of you that don't know, it's classified as a birthmark, but it's actually typically not present at birth, or it's barely present at birth. And then it kind of appears over time and grows over time. And it can be described as looking like a strawberry. In fact, its initial name was strawberry hemangioma because of its appearance's similarity to a strawberry. But they can grow pretty significantly during the first year of life. And then once they kind of peak in their growth, then they settle for a little time and stay the same for a little bit of time, and then they start going away. But some hemangiomas in certain locations can cause problems, and so it's important and nice to have a treatment option that's effective for them. Pediatric dermatologists were a rare breed. I joke that I'm like a unicorn. There are less than 300 pediatric dermatologists in the entire United States of America. So there aren't very many of us. So the first thing to look for in a pediatric dermatologist is to find one close to you because they're not everywhere. And the Society for Pediatric Dermatology has a great resource on their website, spd.net, and you can search by your zip code to find a pediatric dermatologist close to you. So finding one that has appropriate training, that's gone through the residency in dermatology, the fellowship in pediatric dermatology, because kids aren't just little adults. They're different, and the things they get are different. And so having somebody to see your child that has that degree of training is going to make the visit much more comfortable for everybody. I would say, so one myth that is commonly believed in the pediatric dermatology patient population is about the relationship between eczema and food allergy. There are a lot of families who have a child with eczema, and they think that perhaps there's a food allergy that's triggering it. And I will often tell families, I wish it were a food allergy because it would make my life so much easier if I could just tell you and your child what to avoid and fix the problem. But it's actually quite rare that the eczema is being triggered by a food. Now, it is true that people with eczema are at higher risk for food allergy, but it typically is not the food allergy that's driving the eczema. So we refer to them as associated conditions rather than cause and effect. So allergy testing can play an important role for kids with eczema, but I wouldn't go ahead and do it in the hopes that it just cures the eczema problem, because that's really quite rare that there's that direct association. In fact, one of the more exciting things that's emerged in our research over the past year or two is that the food allergy might in fact be triggered by the eczema. Eczema impairs your skin barrier, and so it allows what we call antigen presentation through the skin. So different food particles that are floating in the air or environmental allergens that are out and about have increased access to the immune system of a child with eczema, and that can trigger allergy. So one of the best ways to prevent food allergy is by treating your child's eczema. Something I learned on the job that I was never taught in school is probably just how to communicate with people. You know, when you go through med school and residency, you're taught all about the diseases that you're going to see and how to identify them and how to treat them. But you aren't really taught how to communicate that information with a patient and their family. You know, how do you explain to a family a particular diagnosis? What do you caution them about with particular treatments? How do you frame the conversation in a way that's positive and gives people hope to manage whatever skin condition you're treating, but also be honest about any side effects or potential risks with that therapy? And how do you break potentially bad news with a patient and their family? So I think those were things that I had to learn on the job early in my career. And I'm sure I made some mistakes early on, but I think now I'm pretty good at it. So I love Boise, Idaho. So I live in Boise, Boise proper in the foothills, and I love it. I love the green belt. I love the people. I love how friendly my neighbors are. They weren't that friendly in Colorado. I like the river. I love the river. I love hiking the foothills. I love downtown Boise. It's got to be one of the cutest downtowns in the United States. It's just awesome. I love that there's a college here. It brings young, fun things to the area, so I love that Boise State's here. And I think the biggest thing I love is really the people. People are genuinely kind here. And I see bumper stickers all around, keep Boise kind, keep Idaho nice. And I hope that people follow that advice because I'd love to see it stay this way. Idaho activity. So that's tough. I mean, right now, I would say hiking because I haven't gotten a chance to do much else yet. I haven't tubed the Boise River yet, but I plan to. I haven't even skied in Idaho yet because I was still moving through winter time, and so haven't yet done that, but really look forward to it. And just in general, kind of learning my way around and going to see all the sites. I've heard hot springs are a really big thing here. I'd love to go try some of those out. I'd love to go to Stanley Lake, or Stanley. And favorite health practice for myself, I would say definitely exercise. So I typically work out every morning on my treadmill at home. I watch a sitcom on Netflix or Hulu, and I work my way through the entire season. So I've watched The Office, I've watched Parks and Rec. I'm working my way through Modern Family right now, which is really funny, and that's been a real treat. But I think it's really important, at least for me, to get up in the morning, start my day with exercise. It's good for my body, it's good for my brain, it's good for my energy levels, and I start the day fresh and can get my work day started right after that. At 15 years old, I would tell myself a lot. I would say, keep working hard. Working hard is important not only to achieve certain goals, but also to just be in the practice of working hard and giving back and being a contributor to society. So I would say keep working hard. I would say be nice to people. Niceness, it can never be underrated. Being kind and nice to people will take you a long way. I would say don't look too far ahead. Take each step of your life one piece at a time. If you think about the road it takes to become a doctor, it's a long one. At 15, you're still looking at 2 or 3 years of high school, 4 years of college, 4 years of med school, 4 years of dermatology residency, a year of fellowship. That's a long time. And if you think about it all too much, it becomes too much to consider. But if you just take it one piece at a time, break it down one piece at a time, you'll get there and it's worth it. And I would say laugh and find something funny in everything you do. Yes. So the very first job I had, I worked at a place in Scottsdale, Arizona called Mountain View Yogurt. It was a yogurt and ice cream shop, and it was my dream to work there. I would grow up going to Mountain View Yogurt. We went there a lot because it's Arizona and it's hot. And I desperately wanted to work there. And in Arizona, you could start working when you were, I think, 15 and a half. So the moment I was 15 and a half, I got a job at Mountain View Yogurt. And it was everything I dreamed of. And I worked there my entire high school career. And it was a blast. The most important thing I learned from there, I would say a few things. Number one, how to work with other people. How to work with other people in terms of other staff at Mountain View Yogurt, but also the clientele and the people that came in to get yogurt, and just customer service skills and communication skills. I learned a lot from that. I also learned that I don't think I'll ever get osteoporosis because I ate a whole lot of yogurt and ice cream while I worked there. I think those were the two big take-homes. So as a pediatric dermatologist, my day is full of things like eczema, birthmarks, moles, acne, hemangiomas, psoriasis, warts, molluscum, hair loss issues in kids, all sorts of rashes. Kids get a lot of rashes. I see a lot of fungus. And most of that I can fix, so it's all good. So dermatologists are really quite simple in our skincare and skincare recommendations. I give all my patients a Dr. Swanson's favorite things list, and it has all the products that I recommend, and they're all very simple and very basic things. I remember when I was a kid, a teenager, and my own personal dermatologist was interviewed for a Merit magazine article, and they asked her, "What kind of stuff do you use on your skin?" And I remember her answers surprising me because they just seemed so basic and so bland. But I think if you ask most dermatologists, we're pretty boring with our skincare. We like to keep things gentle and sensitive. I love Vanicream products and things like Cetaphil and CeraVe. Sunscreen is so important, and we prefer sunscreens that have zinc and or titanium in them. They're what we call the physical blockers, and they're very effective and very safe. And so we really just keep things pretty darn simple. So do kids outgrow eczema? Statistically, a majority do. Most studies say that about 80%, 4 out of 5 kids will outgrow eczema, typically by age 8. So when I'm seeing younger kids with eczema, I'll share that with them as kind of a light at the end of the tunnel, a silver lining, but it's not going to happen right away. So it's important to treat the child even when they're going through it. But 4 out of 5 kids will outgrow it by age 8. So insect repellent creams are safe to use. The most effective ingredient is DEET, and the American Academy of Pediatrics says it's okay for kids to use DEET-containing bug spray in a concentration of less than 20%. So that's what you'd want to look for on the bottle, DEET being the most effective ingredient and less than 20% for safety. And so that's an important concern, an important fact. And then when I'm counseling patients on using the insect repellent spray, I tell them to spray their clothes rather than directly spray their skin. It's still going to repel the bugs, and it's not going to cause as much irritation. In addition, there are a bunch of clothing companies these days that make clothes that are sun protective and insect repellent. And so you can find those at places like REI. And so that's very nice and very effective because then you don't have to mess with the spray. It's in your clothes.